Welcome everyone to today's webinar, The Value of Compliance Continuity in the ASC, a virtual overview. I am Angie Stewart with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We're looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it is now my pleasure to start today's webinar by introducing our presenter. Jason Connolly is President of Hotline Software Solutions and has been a technology and compliance executive for more than 20 years. His expertise is in the development and deployment of enterprise software systems in the healthcare, financial, and government sectors. At this time, I am pleased to turn the floor over to Jason to begin today's presentation.
Good morning. Thank you for the introduction, Angie. I appreciate that. I'd also like to thank Becker's and Medline for the opportunity to present today and thank all of you for joining us. As Angie mentioned, today I'm going to be talking about the value of compliance continuity in the ASC. Our agenda for this morning includes a little bit of an introduction about myself and a little bit more about my company. We're going to talk about the evolution of compliance. We'll talk about compliance continuity and actually define what that is. We'll talk about some macro trends in the current regulatory environment. We'll then get a little more micro and discuss some of the current challenges that ASCs are facing. And then we'll talk about some of the solutions out there and what you can do in terms of building a culture of compliance and leveraging technology. We'll walk through a recent case study. We'll wrap up with compliance continuity benefits and answer any questions that you guys might have. So again, a little bit more about me. As Angie mentioned, I have over 20 years experience in the technology and compliance space. I actually have the gray hair to prove it too. My current company, Hotline Software, was formed back in 2008. We actually got our start in the government space. The U.S. Treasury is one of our largest clients. We worked on a program where we allocated over $6 billion in federal funds through 14 state government agencies and really took all those best practices and experiences and turned that into our current product, which is a SaaS healthcare compliance platform that we launched a couple of years ago in conjunction with Medline. So when I first got into this field back in the early 2000s, I used to walk into a company and talk to them and ask them, what was their compliance program. And at this time, this was just around the period where Chief Compliance Officer and Chief Risk Officer were just coming into vogue. And oftentimes, they'd point to a series of binders sitting on a desk somewhere and say, oh, those are my policies and procedures. I paid Deloitte or paid PwC, 10 or 20 grand to develop those for me. And that's my compliance program. And then they would supplement that with, maybe a sample QC or auditing process to help kind of, guide them along. But they were largely reactionary based on what auditors and regulators were fined and then, kind of make adjustments and tweak things along the way, as well as trying to implement systems. And early on, it was, trying to create business rules within production systems and whatnot. Fast forward to today, that type of process is no longer acceptable to regulators and the general public. You really need to demonstrate that your program really is a continuous evolution and monitoring process and this concept of what we call compliance continuity. Let me define compliance continuity a little bit better. So the way we think about compliance continuity is really it starts at the top with your standards and regulations. And so this could be your accreditation agency, it could be a state regulator, it could be a carrier, or it could be a combination of all of those, really creating this regulatory framework for you. But in any event, you need to have continuous monitoring and tracking of updates around those standards and regulations. And a really solid process in identifying those. And then once you've identified changes or adjustments to those standards and regulations, you then need to immediately identify the ripple effect or any changes that are required within your policies and procedures. Because your policies and procedures need to be custom, they need to be specific, and they need to conform to the current standards and regulations that have been published. That process then evolves into process and training. Once you've identified and documented what your internal policies and procedures are, you need to make sure that your processes align with that and that your staff has frequent and periodic training that coincides with those changes, and that those practices and use cases are reinforced through that training and through the processes. That then goes into reporting and accountability, which relies on systems. You really need to be collecting data in real time as you go through your normal activities to be able to document these compliance activities so that you can report on them quickly, and then also identify either gaps in training or gaps in resources, or even just a breakdown in the process. And then you wrap that in a QI/QC review where you maybe have mock audits or some other process, peer reviews, where you come in and have people evaluate this entire process to make sure that the whole system is functioning correctly. And so when we talk about compliance continuity, it's really that constant monitoring of standards, policies, training and process, and reporting and accountability, and then the validation process to ensure that everything is wrapped up appropriately together. Next, I want to talk a little bit about the macro environment and some of the recent trends that are really pushing us toward this compliance continuity paradigm. And so the first of that is legislative activity. Legislative activity continues to be strong. According to the National Conference of State Legislatures, since 2005, more than 2,000 healthcare laws have been enacted. Obviously, that's across all 50 states. We didn't include federal in this chart here. But you can see there's a consistent level of new laws that go into effect each year that we need to be aware of and monitor and track. Although the trend over recent years has been declining, we can see through the first half of 2020 that we're actually on track to exceed the 2016 level. So there are an ebb and flow. Some of these are tied to election cycles and whatnot, but that activity continues to be strong and doesn't show any signs of slowing down. Next is malpractice claims. So we have a very active attorney network, either looking to enforce patient rights or seeking compensation through lawsuits and class actions. The number of malpractice claims, according to the National Practitioner Data Bank, has been pretty steady over the last 5 years, although through the first quarter of this year, we're on track to exceed 12,000 cases. But more importantly, the more alarming trend is the dollar amount in payouts associated to those claims. And so, again, we're seeing this upward spike in the level of payouts. And even through the first quarter of this year, we've already exceeded $1.2 billion, which puts us on track to hit $5 billion by the end of the year, which represents roughly a 20% increase over 2017. So again, that trend is not in our favor. In addition to that, there's constant scrutiny from regulators, whether that's at the state or federal level, as well as the carriers and CMS, through adverse actions and other private actions against certain facilities, trying to identify either those facilities that are underperforming or acting out of compliance. This is a continued process. We've actually seen independent and increased mock inspections and unannounced surveys where individuals are coming in and evaluating current activities within these facilities, and sometimes actually shutting facilities down. So if you take all of those things, starting from the laws and the malpractice and the regulator scrutiny, all that kind of ultimately filters down into what your agency standards are. And we've seen, constant growth and change in those as well. Just this year, AAA released their enhanced standards version 41 with an effective date of later this year. And just within that update, there were over 83 revisions and additions. Fortunately, most of those were consolidation and renumbering, but it still is a process for you to go through and understand the ripple effect and how those impact your current policies and procedures, and what changes or adjustments might need to be made in conjunction with process and training. And so another thing to consider as we go through this. So just in summary, as we factor in all those things, we have strong legislative activity, we have an active plaintiffs bar, we have increased awards and settlements through malpractice, regulator scrutiny, and then growth and changes in agency standards. So from a macro perspective, you're really dealing with a complex patchwork of regulations and enforcement activity. And I think, all of us would agree that, one, this isn't stopping anytime soon. At best, we can hope that it maybe slows down, but this is kind of the new normal in terms of what we can expect from the macro environment. And so having a compliance continuity program in place becomes increasingly more and more valuable and important to implement. Next, I want to talk a little bit, get a little more micro and talk about some of the specific challenges that are happening at the ASC level. And I think we may have missed that slide, but I'll just touch on those briefly here. So one of the first things that we're dealing with is deficiencies and other issues associated to the survey results themselves. According to AAA, in their annual quality report, 10% of ASCs have material compliance exceptions. And that's on top of having gone through the preparation for the survey. Those deficiencies generally equate to another 4 to 6 weeks of work for that surgery center in terms of going through a remediation program and documenting what their corrective action plan might be. Typically, when they're going through a survey, they may engage outside resources, either through maybe a management group or they'll hire consultants. The challenge with those is typically those engagements are outcome focused, meaning they're really just looking to get through the actual survey itself. And they're not really designed to, either train staff or, build knowledge within the facility. Next, there are maintenance gaps. They're, in between your surveys typically is 3 years. You've just spent, 3 to 6 months ahead of time preparing for that survey, and another couple of weeks beyond that going through a remediation plan. After that, you really just want to take a break and kind of get back to normal. So there is some slowdown in terms of compliance and gaps during those maintenance periods that make it difficult to keep that documentation current and those systems running smoothly. The other thing that affects ASCs currently is staff turnover. If you have, maybe a director of nursing or an administrator leave, that leaves a huge hole within your operations. A lot of tribal knowledge exits the facility when those types of positions are vacant or you have turnover. We've also seen an increase in the use of part-time and per diem staff. So, if you may have a nurse that comes in and works, 2 or 3 days a week in your facility, whereas, she might be working at a hospital, some other facility those other days, it's hard to ensure consistency in terms of your process and practices because she may be applying the compliance framework from another facility to your daily operations, which although those might be sound practices, they're not necessarily consistent with the policies and procedures that you've established and documented. And so, again, those discrepancies lead to issues and holes in your compliance program. In conjunction with that, there's policy inconsistencies so that, sometimes you may implement a policy or document something, but the practice that's employed by the staff is completely different. Again, that gets back to training and the use of per diem staff. Oftentimes, in addition to that, you may have an outdated, compliance program or oversight program. Some companies actually do this very well in terms of having their mock audit teams go around and do different reviews and get people prepared and updated based on current survey practices and outcomes. But other facilities, maybe the smaller facilities, that QC, QI program is almost non-existent. And then lastly, actually preparing for surveys is a huge burden as well. We've a lot of anecdotal evidence and experience coming from different clients of ours saying that, historically they've had to spend, 9 or 6 months before their survey actually preparing and going back through and making sure they have the right standards and that their policies and procedures are updated and that they have their documentation in place and all their logs are in order. And everything and being prepared for that coming in. And so that can be an extra burden on staff that's generally, focused on procedures. So what can we do about all these macro and micro challenges? Well, I think the key is, building the culture of compliance. And really that helps begin the foundation of, establishing a compliance continuity program. And so how do you go about building that culture of compliance? Well, first, it really starts with leadership. Senior leadership and owners need to understand and embrace the current environment, need to see the growth in complexity and the regulations and all the external factors that are putting pressure on the compliance demands within the facility, and really need to have a commitment to investing in the people, process, and systems in order to manage that. And if you make those investments, you can reap the benefits of that in the long run through cost savings and reduced exposure and risk, and really be able to turn compliance from a cost center into a competitive advantage. Next is having the proper systems and controls in place. And that entails implementing automated systems to ensure consistent collection of data, either through logs or other reporting requirements, and making sure that it gets documented appropriately. Ensuring that your team has secure access based on their roles and their permissions, that they can go in, have access to this compliance data in real time, and be able to take action on it throughout their normal practices. Next is really consistent training and in-services. So utilizing a reminder system through alerts and notifications, making sure that these compliance tasks are queued up and that the appropriate people know about them and can take action on them, in conjunction with a strong training program to ensure that as these policies and procedures get implemented, that the adjustments to process and people happen accordingly, and through that use of consistent training. And then lastly, it's imperative that you really have transparent reporting and accountability, and you need to have, rely on your systems, be able to access that data in real time to understand whether there has been a breakdown in process or breakdown in training, be able to identify certain individuals that may not be doing it correctly or may not be doing their job at all, and be able to address that quickly and not wait till it's a huge problem and you realize, 9 months before your survey that you haven't been doing a certain log for the last 18 months. So really having that in place puts you in a position to develop that culture of compliance. Next, to talk a little bit about some of the compliance solutions that are out there. Our platform, SCT Core Comply, is the leading provider of compliance and accreditation solutions for the ambulatory surgical space, as well as healthcare facilities in general. There are other systems out there that have some of these features. This is probably one of the most robust sets that we have. But walking through these, just give you an indication of the type of tools that are out there and available for you. So having a dynamic policy library, something that is in place where you can go in, get easy access to your policies, make sure that your staff can easily access those policies, but also having a mechanism in place to review those and update those and go through the proper approval process to make sure that those get updated correctly. Historically, policies have been, printed out, stored in binders that no one goes through. Some facilities have actually taken it upon them to convert those to digital, but again, those are in Word documents or PDFs on somebody's desktop or computer, and not everyone has access to them, and updating them is a real challenge. Having systems to update and maintain employee records and credentialing files, being able to have those securely stored with proper access, but again, with also the tools around it to make sure that when certain components expire or when background checks are required to be renewed, that you have the proper system in place to track that accordingly. Same thing with vendor contracts, maintaining all your key vendor relationships, whether that's the ambulance company you contract with or your medical gas company, making sure that you're aware of those contracts when they come up for renewal and giving you plenty of time and visibility into managing those, in addition to a contract management function to ensure that those get renewed appropriately. Next is having a reminder system in place. So, some sort of tickler to keep you apprised of all these individual compliance tasks, whether that's, a monthly fire alarm inspection or a quarterly governing body meeting, making sure that you're aware of those things, that you can plan for them, and that they're being done in a timely fashion. In conjunction with that, the ability to assign tasks and divide those out and delegate certain responsibilities to different individuals, but be able to track those assignments and understand when they're being completed or if they've fallen through the crack, and have that full accountability built into your platform. Next is electronic logging. A lot of people are trying to move away from the manual clipboards and move to an electronic function. Let's face it, paper gets lost, it disappears. Sometimes these logbooks, someone walks off with them, or there's water damage or whatnot. Just really being able to capture that information in real time and directly put it into the cloud securely so it can be easily accessed and reported upon is really critical these days. Next is having a dashboard, getting the ability to have access to the key metrics that you need, identify the different reporting requirements, understand trends within your own facility or issues with certain employees or within certain areas or functions, and being able to pinpoint those quickly. Next is really about survey preparation. So whether that's having tools to walk you through the survey process and prepare for that, understanding what new standards are and the ripple effect and the impact that has on your facility, as well as progress meters to kind of track as you go through that preparation process and make sure that everyone's apprised of exactly how much work's left and where you're at and when you're actually ready for that surveyor to come on site. We talked about this earlier, having a strong training and continuing education program. Through our partnership with Medline, we have access to Medline University, which has a wealth of continuing education courses that you can sign up for your staff to be able to track and assign those, be able to go in and create your own curriculum packages, whether that's for your nursing staff or your physician or even your front office administration, giving them the tools to be able to do that, but also making sure that you're doing those monthly staff-in services on those different subjects or those hot topics that are coming through, or maybe just adjustments to policy and process that need to be implemented throughout the facility. Next is your safety data sheet and instruction for use management, having a secure place to be able to track and store those as well, but again, giving people the proper access to get to that information, make sure they're dealing with the current forms and the proper forms as well. And that gets into kind of document version control, which is the version of the truth. We've gone into clients that have multiple facilities and even in the best run places, you'll have, certain facilities that might be operating off, maybe last year's version of this policy. And so really having something tightly knit and documented appropriately and be able to version control those and track, make sure everyone's working from the same one is critical. Next, one of the unique features within our system is we allow the inclusion of community insight. So any one of our clients can kind of share their own experience, that has maybe come up during a survey or during a mock review, and some things, and even pose questions. That's, part of the reason why we, attend conferences such as Becker's or ASCA is really to go and engage with our peers and get an understanding of what the best practices are and what other people are doing to address and tackle some of these issues. So having access to community insight to be able to corroborate some things that you might be thinking is critical as well. One of the earlier things we talked about was making sure that your regulatory library of standards and regulations is up to date and current, making sure that you're getting the proper alerts and notifications on those changes and within the proper lead time to be able to go through and make sure that you can, one, understand them, make any adjustments that might be necessary, and then be able to implement those changes in conjunction with your training program. And then the other components here are having the ability to manage your compliance deficiencies, so being able to document those appropriately, as well as any corrective action plans, and being able to demonstrate what changes actually went into the process. And then some of the other technical tools that are out there, obviously, looking for systems with role-based access, with a hierarchy in place so that you can delegate certain responsibilities, but also protect certain sensitive information from people that don't need to see it. Natural search capabilities to be able to access or look through different documents, whether that's a policy that you've written or whether it's a standard, or maybe it could be a log that's already been created and stored, but giving you the ability to go through and search and find the information you're looking for quickly is key. And lastly, other risk assessment tools and being able to identify changes that might be coming down. So That's just an example of that's an example of some of the features that within our system. There are other tools, like I said, out there, and so really, would encourage you to find one that fits you and your needs. But there's a breadth of tools that are available these days that can really help you leverage automation and keep you apprised of all these changes. And what we've already talked about was a very dynamic regulatory environment. Next, I want to talk about a recent case study. This is Dr. Sheila Nazarian with Nazarian Plastic Surgery in Beverly Hills. Some of you may recognize her. She actually just had a reality show launch on Netflix. We engaged with Dr. Nazarian earlier this year, back in March, as she was preparing for her survey. She actually just went through that in late June. And just a couple of things I want to point out here in terms of the efficiency gains that we were able to help Dr. Nazarian achieve. So in her experience in prior surveys, her staff would generally spend 6 to 9 months preparing for her survey. We were able to cut that down to just 3 months. Survey duration, her recollection was that the surveyor would generally be on site 2 to 3 days. This surveyor was on site for 1. Loved the system. They were able to sit down, walk through, query and search different policies, be able to show when changes were implemented, be able to show logs, be able to show history and reports, and really put the surveyor's concerns at bay. Oftentimes, a lot of clients will tell us that, the tone of your survey is really established within the first, 45 minutes to an hour that the surveyor's on site. And so they kind of, walk around the facility, look at, the cleanliness, and then look at your organization. And so having a system in place that's well documented really puts a lot of their concerns at ease and makes that process a lot more efficient. And then lastly, she was cited for 0 deficiencies. She actually got 100% on her survey. In previous years and cycles, she noted that there's always 8 to 12. And what most people don't realize or may not immediately be in tune with is that those 8 to 12 deficiencies generally equate to another 4 to 6 weeks worth of work, because you have to go through and document what your remediation corrective action plan is, and then actually be able to put that into effect. And so with the ability to cut down her survey prep on the front end, as well as removing the remediation time on the back end, we saved her staff almost 6 months worth of effort that they were able to redeploy and refocus back on patient care and patient outcomes. And so that's a recent win that we had. Wanted to get this in front of you guys, just demonstrate some of the efficiencies and real quantitative numbers that we might be able to see by embracing, compliance continuity culture. And so lastly, the benefits of compliance continuity, really let's revisit these. So again, being able to reduce costs and time associated to surveys and your overall compliance. And really, compliance has always been viewed as kind of a cost center and a necessary evil. But I think through the use of different tools, creating a culture of compliance, you can really turn that into a competitive advantage. Gives you the ability to identify areas of concern and exposure in real time. You're no longer waiting, 18 months to find out, that something's fallen through the cracks, or when you go back and actually begin to prepare for your surveys, generally where you find these gaps and these issues. But having systems in place to identify those in real time to be able to take corrective action immediately is huge in terms of efficiency and rework. You can eliminate a lot of the manual processes while at the same time improving your reporting and your metrics, increasing staff accountability, and also train your staff. A lot of these systems, if you have the proper controls in place and you're using alerts and you're using reminders, actually acts as a training tool. So that alleviates a lot of the continuity concerns. So if there is staff turnover, at least you have a system of record in place to show where things left off and where people can pick up and demonstrate how the facility is supposed to be running, and with the ability to report on that. So again, it acts as that training tool and provides accountability. And then lastly, for those that are in charge or tasked with compliance, having those dashboards and reports in place really provides oversight and gives you a clear picture of the overall compliance within the facility. And so, again, just to recap, what we've talked about today is building a culture of compliance, ensuring that your compliance program is a continuous cycle, and really being able to embrace that compliance continuity culture. And so, I hope today was able to give you some insights in terms of some of what the macro trends are, some of the challenges that are happening within the surgery centers themselves, but also some of the solutions out there. So all is not lost. There are tools. There are a lot of hardworking people out there that are doing a great job. It's really empowering them to do what they need to do and what they know they need to do. And with that, I'd like to turn it over for questions.
Thank you, Jason, for that fantastic presentation. And as you mentioned, we will now begin today's question and answer session. So audience members, please submit any questions you have by typing them into the Q&A box you see on your dashboard, and we'll try to get through as many questions as we have time for. We already have a lot of great ones that have come in, so we'll go ahead and dive in here. The first one we have from the audience is, Jason, from a patient perspective, do you have corroborating authority with regulators to ensure appropriate resolve of grievance? So what is available with government authority there?
Well, in terms of, that interaction between, patient interaction and the regulator claims, and so oftentimes what happens is those will manifest themselves through those adverse actions or other inquiries. And so, again, having systems in place that document those incidents goes a long way in terms of at least identifying what occurred and what happened within that.
Excellent. Thank you so much for clarifying that. And to build on that a little bit, how often are regulations and standards updated in the system that we've been discussing?
That varies based on the regulatory agency and the accreditation agency. Typically, they publish new guidelines every 3 years. And so when those updates come out, those will be, our clients get notified of those changes, and those get updated in the system. And then we identify potential ripple effects to existing policies and procedures. So if a new standard, obviously we'd say obviously need to create a new policy in conjunction with the standard, or if a standard gets revised, we'll identify whether or not, which policy is likely impacted by that change, so they can go back in and make those adjustments and get the appropriate governing body approval. There are other incidents where, certain things come out maybe at the federal level or different guidance from CDC. And so as those things come out and get implemented as guidance, we provide alerts and notifications to those. Sometimes those don't necessarily reflect themselves in updated standards, but it could be an adjustment or modification to a process or a policy change.
Excellent. Got it. Thank you for that insightful response. And we have another audience member who wants to know, what type of cost savings can we expect from an automated compliance system?
Good question. So oftentimes what you'll see is if you're currently spending, money in conjunction with a consultant, this may be an opportunity to, reduce that fee with your consultant, because you're going through a lot of the automation and making their job a little easier through that process. Through the case study with Dr. Nazarian, you can see there's real time savings associated with staff time in terms of preparation as well as remediation. And so those are real numbers in terms of either hours that you're paying your staff or the ability to see more cases because they're not focusing on preparing for a survey. So you get the cost benefit of that reduction, as well as the risk abatement for, potential lawsuits or a carrier determines that you're out of compliance.
Okay, great. And another audience member would like to know, does the system include environment of care management or exposure control plan?
So our system, and would encourage any of you that want to see a demo to, reach out to us, and I'm more than happy to have our team go through and walk you through that and answer those specific questions. Our system does come with a complete baseline set of policies and procedures that address the current set of standards out there. We also allow you to supplement and add your own policies to the system, or if you're happy with your existing policies, we upload those for you as well. But it's really having that tool and that system in place to do that. So those specific questions off the top of my head, I can't answer that directly, but there's a number of things in there, and would encourage you to sit through them and we can get into those detailed questions in terms of coverages and what was actually contained within the compliance content.
Okay, got it. Thank you. And does this system include a hotline?
System, yeah, so every new client is assigned an onboarding specialist, and that person works with you through the initial configuration and setup, and then is available for you to reach out to at any point in time. We also have a pretty robust help center with hundreds of different videos that go through either 20 to 60-second explanation on how to add a staff member, how to update a policy, or how to review standard revisions. That information is in there along with frequently asked questions, but you can always reach out to our help desk at any time if your customer service rep is unavailable.
Got it. Awesome. That makes sense. Thank you for covering that there. And we also have an audience member who says they would like to learn more about the tracer system. So can you briefly just overview what you talked about there today and how someone can learn more about that?
The tracer system?
Yes.
I'm sorry. So again, when we're talking about the systems in place and that are available to you, it's one, having access to that information, being able to identify changes in your regulatory framework, and being able to respond to those quickly and making sure that information gets disseminated throughout your facility and to the appropriate people, and then being able to track and monitor the use and utilization of the system either through logs or reminders or other tasks that get completed and collecting that documentation and being able to report off it. So having the ability to trace through all of those items is really the cornerstone and key to developing compliance continuity program.
Excellent. And another audience member would like to know, how long does it typically take to implement a system like this?
So that varies based on the clients and their readiness. It also varies based on whether or not they want to use our policies or theirs, but we've gotten people fully into the system and configured and set up within 2 weeks. Most clients are right around the 3-week mark, but if the facility is prepared and ready to move forward, we can get them up and running very quickly.
Great. And to shift gears a little bit here, we have a question about what is the benefit of the AASF survey versus just having DHS do the survey?
That's really a choice up to the facility. So, you're certainly more than welcome to go through the State Department of Health to get your credentialing and access. Oftentimes, depending on the state you're in, sometimes the state has outsourced that responsibility to one of the major accrediting bodies, whether it's Joint Commission, AAA, or Quad A. And, it's really a personal preference on how you want and what regulatory framework that you want to take on. But in any event, it's important to understand really what those requirements are and making sure that your policies tie back to them. So, again, that's more of a personal preference on who you want. So it's kind of like, who do you want to answer to? In some cases, the DHS will still come in even if you're on utilizing another accreditation agency. But again, it's really just set it up on what you're most comfortable with.
Okay, great. Thank you. And for this system, what is the cost, and how's that cost looking? Is it monthly? Is it per employee?
That's a great question. So yeah, it's a monthly subscription, and it's based on obviously the packages you get. We have a number of different features as we walk through that you can take advantage of, and not everybody wants all of those. And so there are different packages, but they range anywhere from as low as $150 a month up to $600-700 a month, depending on the size of the facility. And we base facility size on the number of operating rooms.
Excellent. Thank you so much.
And all training and onboarding is included in that.
Okay. Fantastic. Thank you for covering that. So it looks like we're coming up on the questions that we want to address here today. Again, like I said at the top of the webinar, there will be a way to access this recording after the webinar concludes. I want to thank Jason for his excellent presentation and Medline for sponsoring today's webinar. Audience members, please enjoy the rest of your day, and we look forward to having you join us for future webinars.
Thank you.